We are recording today's training, and it will be hosted on the ITRC training page for those that are unable to join us. Today's training is sponsored and hosted by the Interstate Technology and Regulatory Council, also known as ITRC. If you have any questions, comments, or need technical support information, please use the Q&A box that you see in the bottom of your screen. We will have 2 question and answer breaks during the training, but you are welcome to put your questions in at any time that you think of them. Additionally, I have posted a poll to get us started. I'd like to welcome everybody today. Thank you so much for joining us. There is a poll that is open for you to provide your sector that you're representing today. On behalf of ITRC, my name is Nicole Henderson. I will be your moderator today for the training. Briefly, the Interstate Technology and Regulatory Council is a program of the Environmental Council of the States. ITRC is a state-led organization composed of over 1,000 members from state agencies, federal government, the private sector, academia, and community stakeholders. ITRC members participate in technical teams which produce tools, resources, and training courses like the one you are participating in today. If you'd like to be a part of ITRC, please visit ITRC's website at itrcweb.org for more information. The full ITRC disclaimer is available on the website, and if you plan to use any ITRC materials, we ask that you review that policy in detail and be sure to credit ITRC. ITRC is partially funded by the U.S. government, and ITRC nor the U.S. government warranty the material nor endorse any specific products. I'm going to go ahead and close the poll for this time. Thank you everybody who has participated. And I will share the results so that you know who is joining us today. This training is going to cover the ITRC ethylene oxide guidance published in 2023. We encourage you to go ahead and visit the website link here on the screen for more information while we are going through this training. And here on slide 6, I'm going to introduce our trainers for the day. All of them were active members of the team helping to put together the guidance document, and they all volunteered to continue ITRC and offer the training with you today. At this time, I'm going to hand it off to April Lazaro from Michigan's Department of Environment, Great Lakes, and Energy to talk us through the rest of the training.
Good afternoon. Thank you, Nicole. Welcome, everyone. Again, my name is April Lazaro, and I will be kicking things off today. This slide is designed to detail our training roadmap. Today, we'll start with an introduction on what ethylene oxide, or EtO, is and why it's become a focus of regulators and the regulated community. Lila will come in and describe the health hazards and where EtO can be found and how it is used. Keisha will introduce the concept of how and when to communicate with the community and other interested stakeholders. Jamie is going to teach us about the various technologies in use for controlling emissions of EtO. Next, we'll hear from Deanna, who will provide important details on the most up-to-date methods for sampling and monitoring for EtO. Following that, Eric will skim the surface of the federal regulations that apply to facilities that generate EtO emissions. Finally, we'll return to Keisha, who will provide information for making plans for continuous outreach and providing resources to affected communities and stakeholders. All throughout the training, we'll add to this roadmap information on our fictional source of EtO dubbed Acme Industries and walk you through what a regulator can do as they try to navigate the complicated regulatory environment. The chat feature is available for use for questions as we move through the training materials, and we'll be making sure to take time at the end of the training. We'll do a couple breaks to address many of the questions that are posed. We'll also be using polls, which we've done one already, and thank you for those that participated. I see a lot of fellow state employees out there. We're going to be using those polls to gain the interests of those who have joined us today. So without further ado, let's jump right in. As I walk you through a roadmap that I showed you in the previous slide, hopefully it got you to thinking about what you will learn about EtO. This training is designed to introduce you to ethylene oxide. Again, EtO, we'll be referring to it interchangeably of both of those terms today. What it is, why you need to know about it, where it comes from, and what are options right now for addressing it. It is important to note that EtO is an emerging contaminant and new information, regulations, and technologies are actively being discussed. So keep in mind this training is giving you a snapshot of what we know in time right now. We hope that the training and the ITRC EtO guide will become a resource for you, and we encourage you to track new information as it is released. The ITRC EtO team has developed this interactive guide, which contains detailed information on each of the topics covered in today's training. The team consisted of members from across the nation and included the subject matter experts. So while specific information on regulations and sampling methods are still being worked out for this emerging contaminant, the guide contains information that will help you on your EtO journey. As you may know, this topic is ITRC's first foray into the complicated world of air contaminants, and it's also our first use of a story map style of guidance to bring you the information that you need to help you in your work. As I mentioned, throughout this presentation, we plan to integrate tips while using our Acme Company sterilizer case study. This is to assist state regulators in formulating a plan for ways to help determine what sources are emitting EtO, how we can determine what regulation they may be subject to, what types of inspection, monitoring, and modeling work needs to be done, and how we can best interact with communities to share this important information. For this exercise, the actual emissions from the Acme Company sterilizer are not yet known. However, initial calculations indicate that they may be at a level of concern for nearby residents. As we walk through the case study during today's presentation, you'll learn how to implement the tools to navigate the regulations, investigate and measure EtO emissions, and communicate with residents and stakeholders. So first, what is ethylene oxide, commonly known as EtO? EtO is a flammable, colorless, and reactive gas. The primary source of EtO comes from industrial activities, and we will share additional information and details on these in our sources section of the training. We will also touch just a bit on endogenous creation of EtO that can occur in microbes, plants, and animals. EtO is classified as a hazardous air pollutant, or HAP, as regulated by the Clean Air Act. The leading health organizations in the United States have characterized EtO as a human carcinogen. Prior to 2016, this was not the case, and that really brings us to where we find ourselves today. And since that 2016 reclassification, the US EPA has been conducting significant outreach because the data has identified that EtO emissions from various facilities may pose a greater public health concern than previously realized. It's important to note that inhalation is the primary route of EtO exposure for those living near facilities that release EtO and from an occupational exposure hazard perspective. For more information, see section 1.1.1 of the EtO guide. As we work through the training, you'll see a small box at the top right hand of the slide that contains the EtO icon. Below that icon, you'll see the word section and a sequence of numbers. That icon will identify where you can go to find additional information within the ITRC EtO guide. We'll move into our next poll question and take just a moment here to tally some results. Thank you. All right, so it looks like we have a good mix of folks that have some experience and no experience. Those look about equal, moderate experience and lots of experience. Well, welcome everyone, and I hope you really enjoy our training today. Now I'm going to pass the presentation over to Lila Beckley, who will walk us through the health hazards, sources, and uses of EtO.
Thank you, April. So April touched on the health hazards, and a lot of these discussions were triggered by that 2016 EPA reclassification of and reevaluation of the toxicity. I'm going to start this next section by focusing on sources and uses to put the chemicals into better context and set up the rest of the training. Okay, so EtO is both a man-made substance and a natural substance produced in the body. In this slide, I'm focusing on man-made or manufactured EtO. Manufactured EtO is mainly produced through oxidation of ethylene with a silver catalyst. More than 97% of manufactured EtO is used as a chemical intermediate for the production of other chemicals. These include things like monoethylene glycol, ethoxylates, and many others. The products that people are generally more familiar with, though, are antifreeze, polyester fibers, and surfactants. So EtO is used basically across a pretty wide spectrum of products. So the remaining 3% of manufactured EtO is used for a variety of services that have to do with sterilization or fumigation. Commercial sterilization is generally done on a very large scale. It's done to sterilize medical equipment and devices, such as bandages, disposable syringes, and tubing. These are items that are sensitive to heat and moisture and could be damaged in other sterilization processes. So that's one of the reasons why EtO is so, it is very effective and is used commonly in this commercial sterilization practice. So sterilization is also done on a smaller, non-commercial scale. It's done at hospitals and clinics with benchtop units that are really the size of dishwashers. So those are very localized uses. Other uses of EtO include fumigation of spices and for pest control. And that leads us to the next poll question. So this question asks, which products are made from EtO raw materials? And I'll give you a few moments to plug in your answer. I think, Nicole, go ahead and show the answers if you're ready. Yeah, so as I was alluding to, EtO is used in all of these different products. And the key point of this poll is really to help illustrate that EtO is commonly used in consumer products that are really part of our everyday lives. So the commercial and industrial processes needed to manufacture and or use EtO for these various applications result in emissions to the atmosphere. This chart shows emissions by industry for the year 2019, and it's based on information compiled by EPA from data sources such as the Toxics Release Inventory, also known as the TRI. While this chart does reflect the most recent data available on EtO emissions, it's important to note that it does not account for EtO emissions from all facilities because some facilities are not subject to reporting requirements. But regardless, it is a good snapshot of the relative portion of emissions from the different industries. So one thing to note here is that while 97% of EtO production is for use in the chemical manufacturing business, that business sector counts for less than half of the overall emissions, as shown in the lower orange part of the pie chart. In contrast to this, a relatively small fraction of EtO is used for commercial sterilization, which does account for about half of the emissions, at least in 2019. And Eric will be talking later in the presentation about the focus on emission reduction in this business sector. Anyway, this slide just gives you a good summary of the general breakdown of emissions kind of across industry sectors. These emissions from industry do constitute a known source of EtO into the atmosphere. But it is important to recognize that there are other sources of EtO that could result in exposure. Many of these sources are the subject of current research. These potential sources fall into two main buckets, primary and secondary. Primary refers to mechanisms that result in direct emissions of EtO to ambient air. Potential primary sources include smoking and general combustion processes. Secondary refers to EtO that's formed in the body as part of chemical and biological processes. These are also known as biogenic or endogenous sources of EtO. The processes generally involve the conversion or oxidation of ethylene to EtO. These processes occur as part of normal metabolism in microorganisms, plants, and mammals, including humans. So these potential sources of EtO are active areas of research. And if you're interested in this topic, definitely look in the scientific literature for publication of studies coming in the future. So now let's talk a little bit more about releases of EtO into the environment. I've already mentioned emissions to air. This can be in the form of stack or point source emissions, as well as fugitive emissions. Fugitive emissions would be emissions coming from building openings or equipment leaks. These types of emissions can occur from regulated or unregulated facilities. EtO can also be released into the environment through accidental spills during transportation, releases of products or wastes at facilities. So what happens to EtO when it enters the environment? Well, EtO is a volatile chemical. It wants to be a gas. It also breaks down very quickly in soil and water. So in terms of half-lives, EtO readily evaporates from both soil and water with a half-life of about an hour. Within the soil and water itself, the residence time is also short, with a half-life of less than about 15 days. So in contrast to this behavior in soil and water, EtO is relatively persistent in air with an atmospheric half-life in terms of months instead of days. So studies have shown the atmospheric half-life of EtO at ranges of 2 to 5 months. So these different fate and transport characteristics does give further support to the idea that air and associated inhalation pathways are important for this. If you're interested in the scientific studies and then the background behind these half-life numbers, do reference sections 2 and 4 of the EtO guidance document. So how can I be exposed to EtO? This question can come a lot, especially if you're working with the public. And there are a couple of key points. when you're thinking about an answer to that question. The first key point is to recognize that the primary route of exposure is inhalation of air impacted by EtO. And then the second key point is that EtO can be present from a variety of different sources. So that said, one area where potential exposure could occur is in workplaces. Occupational exposure may occur for those working where EtO is produced or used, such as chemical plants or commercial sterilization facilities. These exposures could potentially be higher than average, although workplace safety measures are typically in place to mitigate exposure risk. Worker exposures to EtO are reduced by a number of different measures, including improvements in equipment design, engineering controls, operational protocols, and personal protective equipment in cases where occupational exposure limits can be exceeded. Exposure can also occur outside of the workplace setting. EPA has studied potential exposure in areas around certain businesses and identified locations where individuals may be exposed. April alluded to this in her introductory remarks. So in August of 2022, the EPA announced that 25 out of 100 operating commercial sterilizers in the country pose a maximum individual cancer lifetime risk above EPA's 100 in a million risk range, which is an action level used in risk assessments. A risk level of 101 million refers to the likelihood that 101 million people would develop cancer if they breathed air containing a constant amount of the same toxic pollutant for 70 years. This process of estimating cancer risk is a tool used to study and prioritize actions that may be needed to protect public health. As Eric will discuss later, EPA and states have been following up on these risk assessment studies and are taking actions to protect workers and communities from EtO risk. These actions include efforts to update regulations to reduce emissions. More information on EtO risk and how this hazardous air pollutant is being handled is found at that link on the slide. So it's also important to recognize that lifestyle choices, for example, smoking, may also contribute to an individual's EtO exposure. And then finally, EtO can also be found in background ambient air from sources such as general combustion processes, although concentrations in background are generally lower than near places where EtO is produced or used. So there are a variety of different tools to learn about EtO and then learn about air quality in your neighborhood or locations of interest. This screenshot that's on the slide is one of the mapping tools that's pretty handy. This tool is called Air Data. The Air Data website provides access to air quality data collected at outdoor monitors across the United States, Puerto Rico, and the U.S. Virgin Islands. Air Data lets users view and download hourly, daily, and annual concentration data for monitored constituents. It also lets you download air quality index data and speciated particle pollution data. So it's a quite valuable tool if you're interested in learning about air quality. AirTox Screen is another tool that's really useful. It gives a snapshot of outdoor air quality with respect to emissions of air toxics. AirTox Screen also predicts the long-term risks to human health if air toxics emissions are steady over time. So AirTox Screen basically estimates cancer risk from breathing toxics over many years, which is another way of looking at this air quality data. So that was a quick survey of source users and exposure pathways. Now I'm going to turn it over to Keisha to talk about community and stakeholder communications.
Thank you so much, Lala, for that comprehensive look at sources and uses. Now, I would like us to look at some of the community and stakeholder issues. First of all, there are numerous federal, state, private, and public stakeholders who are actively researching and analyzing EtO in the environment. But first, what does stakeholder mean? So ITRC defines stakeholder as a member of environmental organizations, community advocacy groups, tribal entities, or other groups that are concerned or involved with environmental issues, or concerned citizens who are not a member of any organization or group. You should see on your screen a graphic, excuse me, a graphic showing different bubbles. And this is just to give you a sense of some of the potential stakeholders when you're looking at different facilities in your area. There are non-governmental organizations, shareholders, customers, regulators, of course, local officials, faith-based groups, as well as local citizens. Identifying and assessing the needs of multiple groups are necessary for regulatory agencies to make informed decisions. Learning what information they want, how they are likely to react to the information shared, how they will likely expect to be involved in the decision-making process, and what methods of communication are used in each community are just some of the pieces of information that you would need to engage effectively with stakeholders. The ITRC does delve into the aspects of these questions and more in the Risk Communication Toolkit, which was published in 2020. And more information on the Risk Communication Toolkit will be presented later in this course. So, communities and communication, including stakeholders early in decision-making processes can lead to better decision-making. So involving stakeholders early on in the process is the ideal. More later on the less than ideal situation. Regulators and other stakeholders involved in the process need to recognize that people's values and feelings are a legitimate aspect of an issue. So listen actively and acknowledge such feelings. Also, stakeholders often do not distinguish among government agencies, and few understand how agencies are organized. Consequently, they may not understand the lines of decision-making authority. Whenever you're giving a presentation, designating time to provide an overview of your process, including policy document requirements and timeframes, best opportunities and milestones to provide feedback, and organizational structures and interagency relationships is something that you should do and is important to do. Again, engaging with stakeholders from the beginning of the project is the ideal. However, it's not uncommon for interaction with the community to be less timely, but it's not too late. You can engage community interest in a project several ways: by reaching out to your colleagues to discuss the issue or company, by working with your community engagement and environmental justice staff, who likely already have some stakeholder context in the community, reviewing your webpage metrics, and noting media coverage. Remember, a public meeting is an opportunity for attendees to interact with project staff, see presentations, share information, and ask questions. However, in a formal public hearing, which is conducted by a hearing officer, there are only limited amount of time to receive oral and written comments, and oral presentations are usually limited to a fixed reasonable amount of time. Community interest helps determine where, when, and how a hearing should be held. Offering pre-registration for an event also can help organizers with the logistics. For example, if you didn't have a pre-registration, you wouldn't necessarily know that maybe a flyer in Spanish would be necessary. So a pre-registration helps you anticipate community needs regarding English proficiency or ADA requirements. Questions about health risk and exposure, current and former, often are asked during public forums, as Lala spoke to previously. If you're not the subject matter expert on health concerns, invite health officials to present or to be present at the event. Ensure that the risk communicators are adept at interacting with stakeholders in a public forum, and that the communication team is transparent and prepared to discuss the subject matter. If possible, agency and responsible party representatives should be consistent throughout the life of the project. Again, if that's possible. So looking at our ACME case study, our team came up with some potential stakeholders. Who do we talk to about ACME? So we decided that we would like to discuss the project with nearby community groups, air quality agencies, the local government officials such as the mayor or board of commissioners, or the local environmental agency if there's one, state and local health department officials, as well as industries that manufacture or use EtO, nearby businesses, and employees of facilities that use or have used EtO. But remember, anyone in the community can be affected by the use of EtO. Communities may be concerned with worker safety, especially if the employees have been at the facility a long time. And as a note, it's not uncommon for workers who are in the facility to also live in the neighborhood. Also, nearby daycare centers and at-risk populations such as the elderly or asthmatic may be concerned with acne. But communication is key. Update that ACME EtO webpage. It's a good resource to refer those who have access to the internet to different handouts, recordings of meetings, public notice information, also contacts with the local or state environmental agency. And here on the screen, you see an example of one state organization's EtO page, and this is the state of Georgia's webpage. As you can see, there are a lot of potential documents that you have access to and can read. Next, who are your team players? Identify who will collect and evaluate the data. An important piece of this puzzle is to identify upfront how the sampling data is going to be used by the agency. What information will the data provide? Is it for compliance? Is it for health assessments? Is it informational only? It is important to emphasize what we know and what we can determine. Share what has been determined through the agency's investigations. And again, I want to refer everyone to a great resource. It's the ITRC Risk Communication Toolkit. And specifically, there's a section 2.1, that discusses stakeholder engagement. It says effective stakeholder engagement not only reduces impediments to the completion of projects according to schedule, but also helps responsible parties and regulators make more informed decisions. One of the best ways for regulators and responsible parties to reach stakeholders is to identify members of the stakeholder groups who are willing to act as liaisons between the community and regulators. On the screen, you see a map, and it's just a model that is estimating lifetime cancer risks from an EtO facility, or excuse me, ACME. As you can see from the map, the risk decreases with the distance from the facility. And the facility is a orange dot in the bottom right-hand corner. After you've identified who you plan to provide information to, next question is whether you need to provide information in different styles. Remember earlier we had a fact sheet that was in Spanish. Other ways to communicate can include web pages, story maps, social media is popular. Your local and state health departments may also help you to decipher and communicate technical jargon. And the public may need to have the very same data presented in a way that is plain language. With respect to presentation of information, consider the stakeholders who will be receiving it. Keep it simple and streamlined. And when feasible, authors should provide summaries and roadmaps pointing to key findings or recommendations. Additionally, technical documents should be easily accessible and offered in both print and, if possible, searchable electronic formats. So try to avoid those TIFF files that I hate so much. If people are at risk, don't wait to release information. And I want to say that again, if people are at risk, don't wait to release information. If the lead organizations are exploring a potential risk, explain this to the public. Release information to the community before sharing it with the media. No one wants to hear about these things on the internet or TV. Please communicate directly with the community. Individuals and families want to hear directly from decision makers about environmental concerns and hazards in their community prior to learning about it through media channels. Practitioners should make an effort to inform the community and other impacted stakeholders directly and periodically to facilitate trust building. Discuss the modeling results and explain what it means to the community without using too much jargon, and communicate the next steps. What information will be provided? All right, so environmental justice. You may be asking, well, what does EJ have to do with ETO? First of all, the definition of environmental justice as defined by the EPA is the just treatment and meaningful involvement of all people, regardless of income, race, color, national origin, tribal affiliation, or disability in agency, decision-making, and other federal activities that affect human health and the environment. And the EJ definition was recently updated in April of last year. So it's changed a little bit and it's been simplified a little bit, the new definition. Second of all, in 2019, the National Environmental Justice Advisory Council, also known as NEJAC, addressed a letter to then Administrator Wheeler expressing concern that EJ communities are disproportionately exposed to ETO and other air toxins. Specifically, the 2019 letter urged the EPA to regulate ETO to protect public health, particularly for the workers in these facilities and the communities living adjacent to them, who are most vulnerable to health threats from both acute chemical releases and long-term exposures. NEJAC recommended that EPA use the best available science when calculating health risks associated with ETO, provide information on its emission reduction efforts, strengthen its regulatory frameworks, communicate its efforts to local communities in an accessible and appropriate way. So all things that I've already discussed through this presentation. In the particular picture, this is Administrator Regan meeting with residents in Louisiana in his Journey to Justice tour that he took a couple years ago. One tool that is used to help identify communities with EJ concerns is EPA's EJ Screen. The EJ Screen is a preliminary step to identify areas that may be candidates for additional consideration, analysis, or outreach as required by Executive Order 12898. Excuse me. And that's the original environmental justice executive order issued in 1994. EJ Screen graphically displays information on 13 environmental indicators, such as lifetime cancer risk from inhalation of air toxins, 7 social economic indicators like percentage of individuals that identify as people of color and other supplemental indexes. This is a EJ screenshot of Charleston in North Charleston, South Carolina. Basically, the red is the 95th percentile, and then orange, yellow, and more the gray, and then the whitish gray is less of a concern. One thing you should note when you use EJ Screen, it's an estimate. And so you really do need to ground truth some of the information you see in the maps. There are other EJ resources such as EnviroFacts, which is a one-stop source for environmental information. Executive Order 14008, which was signed in 2021, helped to create a climate and economic justice screening tool. Some of you who write grants may notice that this is you're required to look at this particular tool when writing up your summaries. It's an interactive map that uses data sets that are indicators of community burdens in 8 categories, including climate change, energy, and health. The ATSDR released their Environmental Justice Index, which uses data from 4 different agencies. Many states have specific resources, such as Alabama. Michigan has a Michigan EJ Screen. South Carolina has a EJ Community Tool. So check out your own state. You may have your own environmental justice tool. They typically are more specific to the state as opposed to EJ Screen, which is across the nation. The EPA also works with different tribal groups, including the National Tribal Air Association, whose mission is to advance air quality management policies and programs. We have a poll question. Are you paying attention? Name a potential EtO stakeholder. And please, you should have gotten a pop-up. Which says name a potential EtO stakeholder and type in a short answer. All right.
We're still getting a bunch of responses, Keisha.
Oh, okay.
Give it a couple seconds here.
So while that's going on, I'll look at the chat.
All right, Keisha, great participation. Here are the results.
I'm not seeing anything. It says
Lots of community members, state, religious organization,
yes.
staff at a hospital,
Okay.
faith-based organization, communities, by far the most popular answer. Employees, facility workers. Yep, lots of employees again. I think they were listening to you, Keisha.
Okay, great. And ta-da, that's the end of my current section. It's my pleasure to turn it over to Jamie Gore with Georgia Department of Natural Resources, who will be discussing control technologies.
Thank you, Keisha. Well, while EtO is an emerging issue, there are some control technologies to understand and consider. So now that we have already covered a great deal of information, let's pivot to discuss how industries can control the release of EtO into the atmosphere. As Lila previously mentioned, the 2 main known sources of EtO come from the commercial sterilization and chemical manufacturing sectors. Emission controls are an important element of EtO management and regulation. The control technologies generally apply to point sources that are regulated under EPA's National Emission Standards for Hazardous Air Pollutants, or NESHAPs. The goal of the control technologies is to reduce emissions from industrial sources prior to venting to the atmosphere. The specific requirements and performance metrics are established through regulatory permitting. Monitoring is done to verify that performance standards are met. Be aware that emission controls apply to point sources. Facilities may also have fugitive emissions. These are managed by maintenance, leak detection, and repair. Most emissions of EtO occur during production, usage, storage, and handling in commercial and industrial settings. Such emissions originate from stacks and vents and from fugitive sources such as building openings and equipment leaks at regulated and unregulated facilities. In April of 2023, US EPA proposed a standard for fugitive emissions from commercial sterilization and fumigation operations. However, those regulations are under development. Efforts to evaluate emissions from products post-sterilization outside of sterilization facilities, in other words, like a warehouse or storage location, are ongoing and additional work is needed. There's a wide variety of technologies that can be applied to reduce emissions. Scrubbers have different configurations, but the general idea is to pass the exhaust gas through a device which contains wet or dry media that absorbs and removes EtO from the airstream. Clean air is then vented while EtO is bound to the media, which is ultimately disposed of. Flaring and thermal oxidizers rely on high temperature combustion to break down EtO. Bubbling scrubbers work by causing a reaction of EtO gas streams with a low pH mixture of water and acid. The chemical reaction converts the EtO to monoethylene glycol that accumulates in tanks. Catalytic oxidizers use catalysts to promote oxidation or the breakdown of VOCs at low temperatures than traditional thermal oxidizers. Because they operate at lower temperatures, they can be more energy efficient. Selection of the specific technology depends on a lot of factors, including the concentration of EtO in the exhaust gas stream, the volume that needs to be treated, and the desired removal efficiency. And now we will move on to the sampling and monitoring section with Deanna Oser.
Thanks, Jamie. Nicole, can you help me? I'm sorry, put the wrong thing. Now that we've discussed the control technologies, once you decide you need to monitor in the communities, how do you get started? We're going to walk you through some of the questions that need to be answered. If you have known EtO sources, looking at the control technologies that Jamie just discussed is very helpful. But what if you don't know where to start looking for EtO sources? What information do you have? Well, we can look at the air quality permit. Is there any EtO use permitted? An on-site source inspection will allow you to see if there are small amounts of EtO below permitted thresholds that may need to be accounted for. You can research similar industries. Are there emission factors available? In Georgia, we sent out letters to all permitted entities asking how much EtO was kept on site, how much was used in the process, how much was emitted. We wanted to ensure we identified all of the EtO potential sources. You can also use emission inventories, such as the National Emissions Inventory and the Toxic Release Inventory. In Georgia, through these inquiries, we identified a facility with too few employees to report to the Toxic Release Inventory, but had significant EtO emissions. Just as Lila mentioned earlier, not every facility has to report to these inventories. You can also use modeling to perform an estimate of the concentrations at the fence line and in nearby communities. The source I just mentioned did not pass our modeling evaluations, so we knew we needed further investigations. Finally, stack testing can be done to quantify emissions. Once you've decided where to look, pollutant concentrations can be determined through direct measurement or modeling to understand the concentrations in the air, including looking at wind direction and speed, as well as facility operating scenarios. Modeling is a mathematical estimation or simulation used to estimate EtO concentrations across broad areas. It can be used to predict EtO concentrations below method detection limits, estimate long-term average concentrations, and be used to identify areas where monitoring may provide more detailed information. Modeling is typically used for a lifetime evaluation of risk, which is 70 years with exposure of 24 hours per day. On the other hand, direct measurement involves the physical collection and analysis of samples, which are used to determine the EtO concentration at a specific location at a specific time. It provides snapshots, and then you can track those snapshots over time. Nearby wind stations or airports should be used to determine which way the wind was blowing during the sample collection. The direct measurements can be used to confirm model results or facility emissions and to quantify any changes in EtO concentrations in the ambient air over a period of time. When starting this type of project, you need to understand the project goals. Why are you sampling? Think back to our acne case study. Why are you sampling? Is it to gain a better understanding of EtO emissions from sources, such as stack emissions, or an overall ambient air quality characterization outside the facility fence line? Are you evaluating the concentrations of EtO near the community or background sites? Project objectives for the data collected will guide the specific sample locations, number of samples needed, sampling frequency and duration, as well as the quality control and quality assurance actions that are needed for your study. For sampling in the community, locating the best practical site should be a priority. Once we know what our data will be used for, we can then determine the type of sampling we're going to be using. Continuous, short-term grab samples, a community study, or conducting a stack test. If you're conducting a stack test, you may sample for 3 one-hour periods. You may perform continuous sampling, or sampling during a production cycle could provide you sufficient information. However, if your goal is to gather data for chronic risk assessments, a single grab sample or a small group of samples are not sufficient. If you're determining ambient concentrations in a community, there is limited EtO data and relatively few studies exist today. Just recently, EtO was added to the Ambient Monitoring Network's national air toxic trend sites located across the country. Please note, at this time, there are no current consensus ideas on background levels. However, several states have conducted independent studies: Colorado, Michigan, Georgia, South Carolina, West Virginia, and Utah, to name a few. Some things to note for ambient concentrations. EtO concentrations can be greater when you collect them near a source. Low measurements near the method detection limit will have a higher level of uncertainty, and any data used should be evaluated for any qualifier flags or quality indicators. These qualifier flags do not invalidate the results, but can provide the data user with important information that may affect your result, such as canister bias or coalition of compounds. Finally, source emission testing can be used to determine the amount of EtO emitted from the facility, often from the process exhaust stacks. This can confirm the emission factors used by the facility or determine compliance with permitted emission limits. Now that we know what type of sampling will be done, you can evaluate the types of equipment available to achieve these goals. There are different options for ambient and community sampling. The majority of toxic sites across the nation use canister sampling, which uses EPA method TO15 or the updated TO15A. Air samples are collected in a canister over a specified period of time and then sent to a laboratory for analysis. There are 2 ways to collect canister samples: through passive or active, which is also called pressurized sampling. Canister sampling without electricity we refer to as passive, and it uses a standalone high purity flow regulation system that allows the canister to be sampled over a 24-hour period. These samples are typically still under vacuum after sampling is concluded, and leaks with this type of system could invalidate your results. On the other hand, sampling that requires electricity uses a pump or flow controller to collect the sample and is known as pressurized or active sampling. This type of sampling leads to an increased sample volume collected, but could also have condensation within the canister. For samples collected with this additional volume, leaks are not usually a cause of contamination. This method also allows for multiple analysis to be done by the analytical laboratory. There is new continuous EtO analyzers that have been developed in recent years. This equipment typically requires temperature control conditions within an enclosure or shelter, so it might not be suited to community sampling. Refer to the guidance for detailed information such as typical measurement ranges and interferences. And as a reminder, our references to the guidance are in the top corner located on the slide. So how do you determine the best practical sites to characterize concentrations near a community? It's important to ensure samples are collected in the breathing zone, that there are no obstructions present in the monitoring pathway, and to make every effort to ensure sampled air is not influenced by other sources. It may be useful to use dispersion modeling to assist with site selection, as well as identifying primary and secondary upwind and downwind wind directions. That's a mouthful. It's illustrated in the slide here so you can get a better understanding of what that means. Sampling at an upwind site or a site that is not in the vicinity of any known EtO source can serve as a comparison for samples that are collected near a known EtO source. Also, collecting samples at varying distances in the same wind direction may provide information on how the EtO concentration changes as you get further from the source. When determining the sampling schedule, consideration of the facility practices and operational hours is very important. Sampling should be conducted under representative conditions at the facility, but you also want to use a rotating sampling schedule to ensure you collect data under all operating conditions and normal conditions. And finally, quality assurance of the sampling program should be identified prior to starting the sampling study. Will you take side-by-side samples to assess precision? Will duplicate or field blanks be analyzed by the laboratory? Sampling duration, both of the individual sample and the study, is important. Sample collection duration can range from real-time EtO measurements, grab samples where about a 30-second snapshot is taken, to the 24-hour sample collected in a canister. The frequency will depend on the project goals we discussed earlier. Now we're going to hand it back over to Jamie to discuss the challenges of sampling.
Thank you, Deanna. Nicole, can you help? Thank you. It is important to remember that sampling and measurement of ethylene oxide is a developing field. Research is continually being done by multiple parties to better understand and improve the methodology. When planning a sampling program with laboratory analyses, you should understand the current limitations of the analysis. Some of these limitations are EtO calibration standards have had degradation in cylinder gas concentrations that have been observed by EPA and other laboratories. Coelution, where two compounds overlap and other interferences may affect the concentrations determined in the analysis. EtO may also form inside some of the canisters, resulting in a positive bias of the measured concentrations. This is also known as the canister effect. The relative size of the data set and location of the sample collection should be taken into consideration before comparing values. And finally, Data validation is highly recommended to ensure bias is accounted for and data can be qualified appropriately. As we previously mentioned, continuous methods are available for measurements in emission stacks. CEMS, or Continuous Emissions Monitoring Systems, involve the installation of monitoring equipment which analyzes the data on site. Many principles of stack testing also apply to continuous emissions monitoring systems. The difference is stack testing is performed for a relatively short period of time, so think hours, and is often used for compliance determination. While CEMS provides continuous data over longer periods of time, such as for months or years, to provide ongoing monitoring information. Stack testing is often the ultimate determination of compliance. Testing plans typically consist of the identification of the source and associated equipment, the representativeness of the process operation, the pollutants of interest and their expected concentrations, what test methods are to be used, and any other data that is collected during testing, and references to the applicable regulations or permits. Contact your federal or state and local regulations to ensure the use of the appropriate test method. For regulatory analytical challenges, there are a few questions to keep in mind. Is the method sensitive to interferences, such as moisture or other pollutants that are emitted into the exhaust stack? If you are using canisters, is there any occurrence of EtO formation in the canister? Is the test conducted by a qualified individual? Some methods with on-site analysis require trained personnel for the interpretation of the data collected. And finally, is federal approval needed for any requested modifications? Ethylene oxide has been detected in many ambient air samples in both urban and rural settings. Currently, there are inconsistencies in how background EtO is defined. For our purposes, background EtO is defined as EtO in ambient air that is not clearly linked to any particular known or suspected source, such as a chemical plant or commercial sterilizer. As you can see, there are many challenges to sampling and monitoring for EtO. A lot of progress has been made in recent years, but this is still a developing field. You should consult with your local permitting authority and/or EPA before delving into a sampling study. And at this time, I will hand it back to the moderator. Thank you.
Thank you, trainers and Jamie, for turning it back over. So we are entering a Q&A break here, so please feel free to use the question and answer pod. I will let you know that any questions about risk levels are outside the scope of this topic today for the conversation. So for those of you that have been asking some very specific risk calculation questions, we are unable to provide additional responses to those. All right, I'm just going to give a minute for the question and answer pod to refresh. I will also take a moment and I will ask either April or Keisha as the state team leaders to provide a little bit more information on this. But as a reminder, ethylene oxide is an emerging contaminant issue. And so the landscape for regulations and technology is changing constantly. So for those of you that are speaking to some changes coming up, it is an evolving topic. Keisha or April, any comments to just that general statement?
Yeah, thanks, Nicole. I think definitely stay tuned, have notifications set up so that you're receiving communications from EPA on this and watching the docket and things like that for updated information is going to be your best source of getting up-to-date data and any changes in the proposals.
Great, thank you, April. We do have a question here, and Deanna, maybe I'll see if you can speak to it. What types of sensors are used in the continuous monitoring?
So it depends on if you're talking about low-cost air quality sensors, which aren't as accurate for monitoring EtO, but we have seen a couple of sensor continuous instruments that use well, now that I said I could answer it, my brain is going blank, but that use a GC type analysis for the instrumentation for the continuous for stack sampling type things. Nicole, I'll turn it back over to you.
Thanks, Deanna. Just again, looking through some of these, and as an emerging issue, some of the questions specifically on updates associated with other agencies or regulations are difficult for the ITRC trainers to respond to at this time. I'd say to stay tuned. Deanna or Jamie, would you be able to respond to the question about what types of projects would EtO monitoring be applicable for? I think you can summarize some of the comments from your slides.
I can take that one, Nicole. The EtO monitoring in the communities is good to characterize EtO as the impact. We used it in Georgia for the impacts that were being seen by the community members. So we were able to monitor in those quadrants around the facility. It also helps you understand fence line concentrations. I hope that answers the question. If not, please let me know.
I would just add to that, it's also, like Deanna had mentioned, included in all of the National Air Toxics Trend Stations, so it can be compared across the country too.
We also got a question regarding just looking for a range nationally of EtO background levels, and is there any data, or do we know and could provide an approximate range of these levels that have been encountered across the country? And I'm not aware whether there's a compilation put together for that information, but I suspect that more than just the person who asked the question would be interested in that information. So that's definitely something where I think some more research is needed.
That's great. Thank you, April. All right, well, let's keep moving here. We do have some other questions that are not answered yet in the chat. We'll hold them because we do have another Q&A break at the end. So with that, I'm going to transition us. And I believe, Eric, you're coming up.
Thank you, Nicole. The regulations for ethylene oxide vary from broad to focus in nature. The regulated community for ethylene oxide consists generally of those who manufacture EtO, those who use EtO to manufacture other products, and those who use EtO as a sterilant or fumigant. Therefore, the regulations for EtO have generally been categorized around chemical manufacturing industry, those who manufacture EtO and use EtO to manufacture other production, and the ethylene oxide sterilization or fumigation industry, like our Acme company. The regulations for the chemical manufacturing industry typically have a broad focus. That is, they cover a range of chemicals which happen to include ethylene oxide, while the regulations for the sterilization or fumigation industry are much more focused and specific to ethylene oxide. As EtO is a hazardous air pollutant, or HAP, many of the regulations pertaining to it come from 40 CFR Part 63, the National Emission Standards for Hazardous Pollutants, or NESHAPs. The NESHAP from the synthetic organic chemical industry spans 4 sections of Part 63. It is often referred to as SOCME, the Hazardous Organic NESHAP, or HON. Subpart F sets the applicability criteria for SOCME, or HON, and requires that affected facilities then comply with the relative sections of subparts G, H, and I. The NESHAP emissions for polyether polyols production is found in 40 CFR subpart PPP, or 3 Ps. As its name implies, this NESHAP specifically focuses on polyether polyols, which can use ethylene oxide as an ingredient, and so unreacted EtO could be emitted. These polyether polyols are then used as ingredients in a number of commercially important products such as adhesives, sealants, urethanes, lubricants, cosmetics, and soaps, to name a few. The NESHAP for miscellaneous organic manufacturing is often referred to the miscellaneous organic NESHAP, or MON. It can be found in 40 CFR Part 63, Subpart 4Fs. The MON covers organic manufacturing that does not fall under the HON or other subparts of Part 63. Here we find that the HON is currently under review and revision. This does not affect the Acme company, as the commercial sterilizers are not subject to the HON. But facilities operating in the chemical manufacturing industry that are subject to the HON or could become subject to the HON in the future should follow the progress of these revisions to track potential applicability. The regulations for the sterilization industry are much more focused by being specific to sterilization, and then more so by where the sterilization is taking place. The ethylene oxide emissions standards for sterilization facilities is a NESHAP covering commercial sterilization and fumigation operations utilizing EtO. It is found in 40 CFR Part 63, Subpart O. Subpart O is applicable to sources that use at least 1 ton of EtO per year as a sterilant. Therefore, this NESHAP is applicable to both area and major sources. Subpart O is applicable to the Acme company, as it is a commercial sterilizer. The National Emission Standards for Hospital Ethylene Oxide Sterilizers is a NESHAP applicable to sterilizers operated specifically in hospitals. This NESHAP is applicable to hospitals that are an area source. It can be found in 40 CFR Part 63, Subpart 5Ws. Here we can see that the final rule for Subpart O was released in April of 2006. This subpart is currently under review and revision. It is going to be in Acme's best interest to follow this subpart for developments, and we certainly hope that they submitted any comments on the proposed rule before the deadline back in June 27th, 2023. Here we show a bulleted list of items to consider for determining the regulations that may apply to a commercial sterilizer such as our Acme company. Are there any state permits that can be reviewed for similar companies? What state regulations exist regarding air toxics? Does your state have delegated authority for NESHAPs, in this case, Subpart O? Is a facility an area source or a major source? And how do the proposed FIFRA rules fit into your regulatory framework? If so, who enforces these rules in your state? And here we have a poll. What EtO regulations are you aware of?
Thanks, Eric. I'm monitoring the results and we'll share them in a moment. You had a lot of subpart O, none, POM, NESHAP, 40 CFR, 63 subpart O. No wonder it took some people some time to write these in for you.
Now we turn it back over to Keisha to discuss continuous outreach and resources.
All right, thank you, Eric. That went by really quickly. So we're in the home stretch here with continuous outreach. So here on the screen, you see a circle or a loop. And communication with stakeholders is not a one and done, and that's the intent of this particular graphic. It's not a check the box exercise where you post something in a paper, who gets the paper anymore. You have a public notice that no one sees because it's buried in a legal section. Continuous outreach with stakeholders is key for, like I said earlier, informed decision making. EtO is an emerging contaminant, and new information, regulations, and technologies are actively being discussed and published. And the value of consistent communications encourages, again, more informed decision making at all levels. So, continuous outreach with stakeholders is key. So, something with risk communication, and there was a question in chat about effectively communicating test results or modeling results with community. I have seen some of the most effective communication with about EtO in the community with community members with using really bar graphs. So you have the different sampling locations with the data that you've gathered, say a background, and then the facility you're looking at, and then maybe some other place like a near highway. And the eye can very quickly see what the levels are with a bar graph. And then there can be that regulatory line that goes across the bars. And very quickly you can see if it's a problem or if it's not a problem, if the background is higher than the facility or vice versa. So using graphics is very effective. Also maps are effective too. So showing where people are living in relation to a facility, people can very quickly see the lateral extent of a model plume. So accessible resources on EtO that address community concerns become imperative for regulators so that fair and meaningful public involvement can be provided. And remember, that's part of the environmental justice definition. Web pages, fact sheets, infographics, slide decks, social media toolkits, posters, videos are popular if they're less than 2 minutes. Can be used to educate the public about EtO on estimated health risks, state and federal initiatives implemented to reduce EtO emissions, unknowns about EtO, and monitoring data collected to date. Section 7.3.1, as you see in the top right corner, in our story map shows examples of 2 fact sheets that were created as handouts for community members. One was for a meeting in Laredo, Texas in 2022, and the other was for a meeting in North Charleston in December 2019. So we provided these examples so that you don't have to start from scratch. You can take these particular one-pagers and modify it and update it to your needs. And it is a nice thing to hand to the community as you're going through your presentation. They can write notes And it's something it's just one page, you can take it with you. So here's a graphic of 5 key aspects of risk communication. And this was developed by the ITRC risk communication team. Understand how your community sees risk, build trust and credibility, release information effectively, interact with communities, and explain risks and management strategies. And again, you see that circle again. It's not a one and done. Additional resources to discuss ethylene oxide. The EPA has their FAQs that are updated regularly. ATSDR has a clinician's brief, as well as a community engagement playbook for ETO. The safety data sheet for ethylene oxide is provided by OSHA. The FDA is also involved with the regulation of ETO because of the sterilization aspects of ethylene oxide. The CDC has a toxicological profile for ethylene oxide, and various states have specific regulations on ethylene oxide. Our interactive guide has done a lot of the research for you. So if you look at our regulatory framework section, you can click on any state and it will give you the ETO resources. So wrapping up this particular webinar, some key points about ethylene oxide. Ethylene oxide, again, is a flammable, colorless, and reactive gas, and is one of the 188 listed hazardous air pollutants covered under Section 112 of the Clean Air Act. ETO sources are where ETO is produced or used, such as chemical plants or commercial sterilizing facilities. Also, ETO is a combustion byproduct, and the conversion of ethylene to ethylene oxide occurs in plants and microorganisms. Remember, in the air, ETO undergoes measurable rates of degradation. ETO is a human carcinogen. In August 2022, the EPA announced that 25 out of about 100 operating commercial sterilizers in the country pose a maximum individual lifetime cancer risk above EPA's 100 in a million risk range. ETO is used in many products. It's used as a chemical intermediate, a sterilizer of medical devices, a fumigant of spices, and as pest control. There are many stakeholders, including regulatory agencies, members of environmental nonprofits, community advocacy groups, tribes, industry, and concerned individuals who are not a member of any particular group. Remember the graphic with the mini bubbles. There are several control technologies that exist to treat emissions from industrial processes. Before venting to the atmosphere, industries are typically required to have permitting and monitoring set in place. Regulations generally are divided into 2 categories: commercial manufacturer use of ETO and sterilization using ETO. And more updates are forthcoming, not only from the EPA, but from other groups who study ETO. And again, this is the link to the interactive guide. Feel free to check it out, and you can do a keyword search if you don't have time to read it page to page. Hopefully you find it informative, and now I would send it back to Nicole for our second question and answer period.
Yeah, thanks, Keisha. And thanks for squeezing in the answer to a question during your presentation. That was fantastic. And so I do have one, and I do remind everybody that you can go ahead and use the Q&A pod for additional questions. But the one that I was going to ask of the group, because I saw some conversation around it in the chat, was, are there handheld equipment that can be used for determining the ambient concentration of ETO within the boundary of a facility? Deanna, do you want to come on and take that?
Yes, as soon as I find my unmute button. So would you repeat that question again, Nicole, please?
Yeah, it was the one about the handheld equipment, being able to determine the ambient concentration.
Sure. So there's a difference in, it depends on if you're asking about handheld versus kind of portable equipment. The handheld equipment, there are some out there that say they will measure EtO, but they won't give you an accurate number. By handheld, I'm thinking like literally a very small portable photoionization detector. They're not usually calibrated with ethylene oxide. They're calibrated with other things. And they have not historically been very accurate for giving you the actual EtO concentrations. There's portable equipment that's often used inside of a facility that can also be used as a continuous emission monitoring system. And that's, we've seen 2 brands, again, no recommendations, just 2 brands we know of that are out there, a Picaro and an Aroma. They both are basically gas chromatograph. I think one of them has a pre-concentrator, and we've actually seen those used fairly well in both stack testing and inside the facility to monitor the emissions off the process inside the facility. Hopefully that answered the question. If not, please put it back in the chat and we'll try again.
Yeah, thanks, Deanna. Great. Well, as we wait to see if there's any additional questions that we can respond to here during this Q&A break, the guidance document is online. This training is recorded and will be hosted on the ITRC EtO training page. You should receive an email once we have this available, and you can share that with colleagues and friends. Trainers, I will direct your attention. We did have a question come in, and I'm not sure if there's anybody that would be able to answer.
Is this the question about the commercial chemical versus sterilization?
Yes, Keisha, thank you.
I think Lala spoke on that before.
Yeah, if we could look at slide 18, I think that might be the one I'm thinking of too, Keisha.
Historically, I believe that the commercial sterilization industry did release EtO. That slide with a pie chart, if you can go to that, was a really good summary. I know a lot of facilities have been adding emission control devices, so it's probably time to update that slide when the data become available.
Yeah, thank you. It's difficult to go back to the slide at this time. But slide 19, for those that want to follow along, the slides are available today on the ITRC training website, and I will put that again in the chat here. All right, well, we have slowed down with questions, and so I'm going to take this opportunity to thank all of our volunteer trainers. They put together a great guidance document and framework for you guys to use, and have worked hard on giving and delivering this training today. Again, it will be recorded. It will be hosted on the ITRC EtO training page for future use and reference, and we appreciate you guys attending. As soon as I end the webinar today, it should populate a feedback form for you to provide some information and responses to your experience today. But big virtual round of applause to our trainers and our attendees. Thank you so much for joining us today, and enjoy the rest of the day.